Sigler, and I'm doing my video presentation on herpes simplex virus. There are two types of herpes simplex virus. The first type is HSV1. The second type is SHV2. SHV1 is known as the oral herpes, and 2 is more as the genital herpes. Those are pictures where you can get the genital herpes around the lips and different, and as you can tell, around the lips they have more of a scab, cold sore area. They're also called canker sores. When you have the genital lesions, as you can tell, you can have them around the head of the penis, and it's in males as well as females. They're more on the outside of the labia, but there are more common. They're sometimes on the inside, but not as common on the inside as well as on the outside. It can be caused an extremely contagious virus. Its virus is transmitted from person to person. The HSV1 can be contracted by sharing drinks, the chapsticks, or the lip balm, or by kissing an infected person. The HS2, which is a sexual contact, it be contracted from sex to sex, or HSV1 to HSV2. The virus can be passed on from any infected individual when the person is not even having an outbreak. The virus spreads quicker when you are in an infected stage than you are without an infected stage, whether contact or not. The virus can be spread through oral sex as well. For instance, if the person has HSV1 and have the cold sore or the blister, you can contract the virus that way because of the fluids in the blister area. Here are the picture of a male and female and how the blisters are around the area in a cluster form. 67 people are positive for HSV1 and don't even realize it. 20% of adults who are sexually active can be infected with HSV2 and not even realize it. And here's statistics of 25% of women and 20% of men, which equals to 50 plus million people, or 85% of the people who don't even know that they even have this disease or virus. Any individual can come in contact with the herpes simplex virus no matter of the age. The risk factors are sexual relations at a young age, a weak immune system, or more commonly this day and time, multiple sex partners. If a patient becomes pregnant and has HSV1 or 2, they need to talk to their doctor about this so they can take precautions necessary to prevent the baby from being exposed. With this, the doctors sometimes prefer that you have a cesarean because they keep it from crossing over from the mother to the fetus. Doctors may prescribe the antivirus such as a cyclovir toward the end of the pregnancy to prevent an outbreak at the end of toward delivery. The signs and symptoms, you either have the sores in the mouth or the genital area. You have painful urination, itching and burning, and with women and some men, you have tight clothing. The tight clothing can cause very discomfort with this also. You'll also have the flu-like symptoms, fatigue, headache, fever, lack of appetite, or swollen lymph nodes. But you will have the swollen lymph nodes around the area that is infected. You have the herpes keratitis, which is spread around the eyes. This includes pain or discharge in the eye. When you are diagnosed with HSV, you have to have a physical examination. With the physical examination, a lot of times the doctor may do a culture around the area that is infected. Other than that, they have a blood test to detect the HSV antibodies in the blood. This test is not commonly known with the other STD tests, so with this you have to be honest with your doctor about things because it is not a common test to be done. The antibody test differentiates between the HSV1 and the 2, and you only know if it only shows if you are exposed or have had the HSV. HSV1 and 2 are both incurable. Treating the signs, you only treat the signs and symptoms with OTC pain medications that will give you relief. The doctor may prescribe antivirals such as cyclovir, famcovir, or vancomycin to help prevent the outbreaks. The antivirus prescribed to reduce the transmitted disease to other individuals as well as HSV1 or 2. The medications are not 100% effective, but decrease the chance of transmission significantly. It also helps decrease the chances of having outbreaks and instantly of the outbreak. The medication comes in different forms such as pill, injection, or a cream. Some individuals continue to have outbreaks frequently while others may have the initial outbreak. Then the virus becomes dormant. People who are infected with this virus will have the virus for the rest of their lives. People may be symptomatic, but the virus will still be present. The virus remains in the nerve cells. Outbreak may not be as severe over time because the infected person's body begins creating antibodies, but this does not mean it still cannot infect someone else. The triggers that causes the outbreak will be sun exposure, sunburn, menstrual periods, fever, illness, weakened immune system, and of course, the main reason, stress. Prevention of spreading the HSV on the HSV1 is don't have physical contact with other people. Don't share cups, chapsticks, silverware, towels, or clothing. Do not let someone eat or drink after you. Avoid kissing or sexual activity during outbreaks. Don't touch sores with bare hands. Always apply medication with a cotton swab. And always wash your hands thoroughly. On the HSV2, you avoid sexual contact of any kind during outbreaks. When not experiencing symptoms of outbreak, always wear a condom. And these are some of my references that I have used to help with the PowerPoint. And that is my presentation.